when I started counseling school, they don't tell you how much emotional work you're going to be doing learning how to be a counselor. So my first semester, I almost failed my skills class. And it wasn't even like, it wasn't that bad. I was fine. But my professor could tell. She was like, I don't think you're okay. And I just wanted to check on you. And I was like, no, I'm not okay. And so then I had to go through, I call this like the it never goes away phase, where I had to work on getting accommodations and stuff for my anxiety and depression because the reality, at least for me, is they don't really go away.
Welcome back to the You Need a Counselor podcast. This is a show presented by Heart and Solutions Counseling Agency. We release new episodes every Sunday at 5 p.m. Central and encourage you to batch up that laundry, put away the dishes, plan for the week ahead, or do any other task that might seem daunting while you give our show a listen. You might just be encouraged to call your therapist, connect with this week's guest, or seek out those services you've been considering for a while but haven't made the commitment to yet. If you are in the state of Iowa and are in need of mental or behavioral health counseling, give us a call at 1-800-531-4236. Enjoy the show.
Hello, and welcome back to the You Need a Counselor podcast. My name is Dr. Julie Johnson. I'm the president and founder here at Heart and Solutions, mental health and behavioral health counseling here in Iowa.
And I'm Chrissa Hunt. I am our Vice President in charge of the Behavioral Health Department. And this is our podcast, You Need a Counselor. So we are a podcast designed for people curious about counseling, but have barriers keeping them from experiencing the benefits of counseling. Our mission is to share stories about counseling, good, bad, and indifferent, and spread the message that everyone can benefit from mental health and behavioral health counseling services.
Our guest today is Cheyenne Heflin. She is joining us from Florida today. She is currently enrolled as a mental health counseling student, which is always so exciting to us because we need more counselors. Cheyenne is also an advocate for those with disabilities, those with chronic illnesses, navigating the mental health world. She utilizes her own individual experiences using counseling, as well as her experiences as an above-knee amputee to help support those in our communities that struggle with the real barriers to mental health services that can come when we have a chronic illness or a disability. So welcome, Cheyenne. Thank you for being here.
Thank you for having me.
Wonderful. Now, all right, so tell us a little bit about your story. What got you involved in the mental health field? What made you want to be a counselor?
Definitely. So basically what ended up happening was I'd had kind of like a traumatic childhood before this, but the big moment that really triggered it for me was I got diagnosed with pediatric cancer when I was 13. And so I ended up going through a year and a half of treatment, which included chemo and then inevitably, unfortunately, an above knee amputation as part because I had bone cancer. What ended up happening was when I was done with the treatment, I got the big hurrah, you're done. I went home, nothing. There was no support for adjusting back to being in life after spending a year and a half wondering if you were gonna be alive at the end of it all. And like people don't realize that kids they can tell, that it's really serious like that. And so I started high school as if, nothing happened, but you're starting high school with like no hair, a missing leg, in a wheelchair, still very sick. And I just realized like there was nothing to help me transition from being basically living in the hospital for a year and a half to my new normal of being, disabled, or at the very least being concerned that, cancer would come back. And so over the years, I've seen stuff pop up, right? We have survivorship clinics and stuff now that follow you for a distance. But the area that I think is still very much lacking, not just for pediatric cancer care, but chronic illness and disabilities in general, is the mental health portion. Like so much of these conditions, like by their very nature, they don't go away. I don't get a moment where I'm going to be like, aha, I'm cured. My leg grew back. Woo! I'm forever going to be an amputee. I'm forever going to be worried about potentially getting cancer again. And so to me, it's kind of baffling that still to this day, we're having to have a discussion of, mental health care would probably be really good for these people who are basically suffering on and off for the rest of their lives. So that's why I'm here.
Yeah, definitely. Well, like you said, you were 13, so that's not even like super young. Like we all remember life at 13. So that's like
Mhm.
where you are conscious of everything going on. How did, I know you eventually were able to get into counseling. Was that shortly after getting released? Or I don't know, like released from or cancer
No,
free,
it
I
was
guess, or how
several
did that
years. It
start?
was several years later. Um, there was a period, and I'm sure a lot of people go through this, where I was kind of in denial about just how bad my problems were. And I thought like all I need to do is push through. I've been through worse things than this. It took me but I graduated high school and had started college before I actually realized like, oh crap, I probably need to go see somebody. This is getting bad. So it was probably like end of freshman year, beginning of sophomore year of college, which would have been like 2018, 2019, when I finally started seeing a counselor for the first time.
And how was that process for you, kind of starting that process?
It was definitely stressful. The first couple people I met with weren't, it's not that they weren't a good fit, but they were the school's counselors. And so we only got so many sessions with it. Well, that's not even true. The first one ended up passing away. Like 2 or 3 sessions in, and then nobody reached out to me to schedule me with somebody else. So I kind of fell into the wayside for a little bit, which was totally just, they were trying to scramble to reschedule everybody that was seeing this person. It was totally understandable. In the moment, I just didn't have the foresight to even think about that. I went back after like a semester to get set up with somebody else. And the biggest issue that came up then was we only got so many sessions with them. And this counselor could tell that I needed way deeper work than like 6 sessions might offer. So we handled a lot of immediate like school related stuff, but didn't get too deep into like the why of why these things were happening. It was only when I was about to graduate, I think it was like junior year, I was thinking about graduation and how I'd have to drop this counselor. I finally started actually looking in the community to find somebody. And luckily enough, after all of that, the very first person that I spoke to ended up being a fantastic fit. And I started what I would say is probably my formal, like I went deep and actually did some work type counseling.
That is traumatic that your first counselor like passed away too. And then, I
Yeah,
mean,
yeah. And I didn't even find out, I found out through a Facebook post.
wow.
Um, they had tried to call me, I guess, but they didn't say in the phone call that there was a serious issue. They just, some random person called me, and then I tried to call them back and they didn't respond. So that was definitely,
Yeah, that is a crazy start to counseling. I'm glad, yeah, when you finally found someone that it was a good fit. And I know you mentioned in your bio to us too that you had to go through different stages in your counseling of kind of like opening up about your past traumas. Can you kind of go more into that and how that was for you?
definitely. So this has been something I've noticed like, oh, so I started in like 2020, basically, when all the crap started happening to now. There have been different phases I've gone through emotionally. And I think this has to do with like the trauma, right? Is like there's different layers to the trauma you unravel as you take care of one, another one pops up and you're like, oh, there you are again. So the very first thing was just trying to learn how to manage my anxiety because I had really bad anxiety, really bad depression, and it was interfering with my life. So that was kind of a traditional cognitive behavioral therapy approach where you're trying to tackle, you know, the thoughts going on in your head and what you're doing in your day-to-day life that might be making you feel better or worse, right? I really liked it because I've always been a very like intellectual person, so CBT made a lot of sense to me. What I ended up realizing during those first few months was I was in such a bad place that I couldn't actually focus on doing the work. So the next stage was realizing, hey, I might need some medication to help me be able to actually do the work in counseling to feel better. So in like June of that year, I ended up seeing a psychiatrist that my counselor recommended, got started on an SSRI, which helped a ton. And then I was able to go back and actually go through the CBT stuff again and really work on building those skills to counteract the anxious thoughts going on in my head. So that went great. We got to a point where those were pretty much taken care of. The next phase I kind of went through was I ended up in a situation where I used to use a prosthesis and walked around and all that good stuff. I got into a point where I was physically not able to wear one anymore. So the next stage for me was I had to basically like accept that I was disabled all over again because I had gotten so used to being able to walk around and pretty much do whatever I wanted. I didn't really use my wheelchair or crutches or anything like that. But I went from not using those at all to having to use them 24/7 because that was my only option. So I went through a phase where I had to learn to accept, like being disabled, being in the chair is not a bad thing. I'm doing what I need to do to take care of my body and to be able to do what I want, which at that point I was already looking at PhD and master's programs for psychology and counseling. Most recently, when I started counseling school, they don't tell you how much emotional work you're going to be doing learning how to be a counselor. So my first semester, I almost failed my skills class. And it wasn't even like, it wasn't that bad. I was fine. But my professor could tell. She was like, I don't think you're okay. And I just wanted to check on you. And I was like, no, I'm not okay. And so then I had to go through, I call this like the it never goes away phase, where I had to work on getting accommodations and stuff for my anxiety and depression because the reality, at least for me, is they don't really go away. They get better, and there's periods where I don't really have any symptoms, but there's definitely periods where they come back in full force. Starting counseling school was one of those because it was so stressful. But thankfully, my program has a wonderful support system. So they all worked with me. I got my accommodations through the university. We ended up great. I'm now at a point where most of that is pretty much handled and I feel really good. But recently, I've realized that the next big challenge I'm going to have is attachment trauma. So I had very unstable relationships in my early childhood that made me feel like I wasn't wanted. I needed to just be kind of a silent observer in order to be present. And that makes it really difficult for me it doesn't affect my counseling at all, which is the weird thing for me. I can still like connect, but I think the thing for me is I keep everybody at kind of a professional distance. And I find it hard to let people in to be friends or like significant others. So I'm at a point now where that's where I'm kind of am in my journey in personal counseling, right? Is trying to go through and be like, okay, I know this is a problem. How do I work on that? So that's kind of where I am now.
Absolutely. I mean, I love what you described about your willingness to, one, to go to counseling after having those experiences previously, your willingness to explore medication routes, because there is such a biological, everything about mental health is it's health. It's our brain that's doing it. It's our nervous system that's creating these things. And so your willingness to explore medication management is huge. And it can be such a barrier for so many people because there are so many negative messages that we get about medication for mental health at the same time you had just gone through your teenage years having poisons, right, put into your body to fight cancer. So when I think about kind of the double standard, right, that there is for bodily, what we would consider like bodily health, and the things that we will do, the medications that we will take for even like Ozempic, right? Weight loss, like the things that people are taking voluntarily. And the pushback that we get so many times about talking about medication management, it's such a double standard. So I just think that it's such a great example that you're showing that yes, you were like, hey, I have enough self-awareness to see that I'm not in a place to be doing this part of the work. So we need to get that squared away and stabilized, and then I can really put myself into that. I think that's such a beautiful example. I'm also so inspired by your willingness to seek out and find those accommodations in school, because so many of us don't. I think back to when I was in grad school, and I also I mean, in my internship, I was in my mentor's classroom just crying all the time because I was like, I can't do this job. This job is like, this field is not for me. I can't do it. And and so, but I never at that time, this was what 14 years ago, right? So I didn't think at that time about, hey, maybe I should be trying to find an accommodation for myself, right? So I just love that you're actively living that right now and that you are setting that example for other people. So even recently in our state are testing for licensure for mental health counselors. We found that they will provide accommodations, and we've had lots of people go through and get those accommodations, and that's so helpful because it makes things fair. It levels the playing field so that everybody is starting on the same page. And I think it's so important, that advocacy for ourselves. So thank you so much for setting that example for other people who might be going through that. And so you talked about having some attachment challenges before you had cancer. Once you were diagnosed, did your process of being diagnosed and going through treatments and the amputation, how do you think that impacted either the attachment challenges or the anxiety and depression that you were already experiencing?
Yeah, so I think by that point I hadn't fully realized that I had anxiety and depression. Just to kind of explain, my mom was abusive physically and emotionally. Okay, so the first several years of my life were very up and down. She was also a substance user. I know she had some kind of psychiatric disorder. I do not know what. So I've gotten past kind of like, I've forgiven her. I'm like, you were not given the help you needed. I can't be mad at you for the rest of my life when there were good moments. So that took a lot, but that's kind of the background we're coming from. When I got into the cancer treatment, I had basically told her I wasn't going to live with her anymore. So that went about as great as you could imagine it was going to go. I was living with my dad full time, which was good because he provided that stability I needed. But I had only just started kind of finding myself socially in middle school. I was starting to hang out with people more. I started feeling a little more confident around people. And then I got diagnosed with cancer and got pulled out of school and basically lost contact with everybody I had been friends with. I would go visit them sometimes when I was out of the hospital, and they were always really nice, but it always felt off. Not because of them. It was me. But you're coming in sick, disabled, and you've missed time because everyone else has been together all school year. And you're kind of just like, I literally don't know you people anymore. You've changed a lot since the last time I saw you. Then, on top of that, my dad got full custody of my two sisters. And when he did get full custody of everybody, we ended up moving because he worked like an hour or so away from where we were living at the time to be close to my mom. So then not only did I not go to school with them during eighth grade, then we moved away. So then I had no chance of even going to high school with some of these people and maybe reconnecting. So I basically had to start fresh in an entirely new city at an entirely new school with people who had been going to school with each other for years and years and years by that point. I think it definitely, it could have been so much worse. Where I ended up for high school was a really supportive environment. It was a small private Catholic school, so I didn't have to worry about a bunch of kids being around. I did not get bullied at all the whole time I was in high school, which was truly a miracle. And I thank the universe for that every day, because I was not only, disabled, bald, all that good stuff, I was also a huge nerd. So, the fact that I didn't get bullied was honestly a blessing, because I don't think that wouldn't have gone well. But it definitely just aggravated all of those issues that I didn't even realize were issues, to the point where I was doing okay by the end of high school, but like there was definitely like things I wasn't noticing and things I was kind of ignoring about how I felt around people in school and how I felt um, dealing with the challenges of my daily life. I think it would have been that way regardless, even if I hadn't gone through the cancer thing. But I think what cancer did was made me feel like I was constantly behind everybody else. And so I already felt weird because I didn't feel quite right around people. But then cancer just came in and went, well, now you're even worse because these people are all doing this and you're not doing that. What are you doing? I took a whole year of your life away. You got to work your butt off to catch up. And so that kind of like implanted a message in me that I had to basically break my own back in order to try and catch up with everybody else. And it's taken many years for me to get to a point where I still struggle with it, to be clear. But I can now talk to that voice in my head and go, nope, we're not doing that. We're gonna go at our own pace, and it's okay. And you can make me feel as anxious as you want, but we're not gonna push ourselves to the point where we collapse and burn out again. I'm not gonna let you do that to me again.
Yeah, definitely. When you look back at that time, like when you were pulled from school, are there resources that you think would have been more helpful to kind of like incorporate time with friends? Or I know counseling obviously would have been helpful at that time and you didn't really get it till college, but things that you can think of that kids maybe don't necessarily get when they get a cancer diagnosis that would have been more beneficial and helped during that time?
That's a good one. So I did at least, like, I was going to school the whole time that I was in treatment. But the way it worked is the program we had was called Hospital Homebound. So what happened was there was a teacher in the hospital who would do work with me while I was in there for treatment. And then there was a teacher that would come to my house when I was at home and work on me there with me there. So I graduated on time despite being in cancer treatment, which was honestly a miracle that I managed to do that. But I had really good teachers who like were, they understood what my limits were and they worked with me. And I was a smart kid, so like luckily I didn't have to do a lot to keep up with the coursework. As far as so I don't know what could have been done in the moment. There are things that exist now in my area that I think are great alternatives to being able to just like go to school. So this is actually a really great example of stuff that could be set up. So there is a nonprofit in my area here. I live in Tampa, obviously, to be clear. They're called the One Voice Foundation. They're actually set up by my previous oncologist. What they do is they have a school program. So kids who are in cancer treatment in the Tampa Bay area can come with their siblings and get tutoring and school assistance at a safe like facility that's designed specifically for cancer kids. So it's sterilized frequently. The volunteers all know how to work with immunocompromised people. So not only do the kids, get the academic support they need other kids who are going through the same stuff they are, and they all get to hang out and they have play programs. They go out and do fun things, all kinds of stuff. And it supports the whole community of cancer patients in the Tampa Bay area. That's not exactly a model that's easy to install everywhere, right? That would be the ideal, though, I think. Some kind of program, even if a hospital just had like a meetup thing where it's hard to meet up with your real life friends because you're sick, right? And you're worried about bringing in other people. But I think the thing that helped me the most throughout this whole experience was meeting people who were going through the same thing I was. One of the patients I met is actually a really good friend of mine now, and we're still talking to each other even after leaving treatment. And that kind of thing just made me go like, someone gets it, someone understands what I'm going through right now. And in the end, you realize, aside from being the sick kids, you end up having a lot more in common than you might think, and you end up having a lifelong friend who went through the same traumatic thing you did.
Absolutely. There's so much power in that, in connecting with somebody who really understands. And I imagine there's so much, well, I know with chronic illness, there is so much isolation that happens, and it feels so isolating, even when there are those external supports, even when we do have a strong family network or we have a strong social network or community network, that still feels very isolating, even when we've got people around us. And so that ability or that opportunity for connection, especially at that age, I mean, 13 to 15, that's when we're making those connections. That's when we're discovering who we
Mhm.
are within our peer group, so that, that those peers hold so much importance. Those peer relationships have so much importance in our development of who we are as an individual. And so programs like that, One Voice Foundation, absolutely, and other support groups where we can meet people who have
Mhm.
gone through similar things or are going through similar things. And I also love that you identify that with that lifelong friend of yours, it's not just that you both had cancer, right? It's
Mhm.
that you have this genuine connection with the other person, but you were able to establish that connection because you knew, okay, this is a person that I can now explore who I am, who they are, knowing that we do have that foundation of understanding.
Mhm.
So I think that is just beautiful. The other thing that you talked about that I'd love to hear more from you about is forgiveness. Forgiveness is such a huge barrier for so many people when we're talking about our healing journeys. Tell us more about forgiveness and how you got to a place of forgiving your mother in your life.
That has been a long journey. That was not something that happened very fast. And I think that's, if anybody wanted to take anything away from today, forgiveness does not come easily. Okay. I was mad at her for a really long time. Um, Even after I left and moved in with my dad, she would still come for like visitation and stuff. But after I told her I didn't want to live with her anymore, she just never treated me the same. I always felt kind of um excluded emotionally, right? She would like love and dote all over my sisters like she normally would, but there was always some kind of like distance between us. Even if I tried to cross it, it just never quite resolved. And so I ended up getting like angrier and angrier, and it kept getting worse because when she'd call and visit, she'd say the same stuff over and over again. She'd be like, "We'll be together again soon. I'll get you guys back. It'll be okay." And I'm sitting here knowing full well, no, mom, that's not going to happen. The turning point, I think, where I realized I don't want to be angry with her for the rest of my life She passed away in 2017. She got into a car accident and didn't go to the hospital and ended up passing away in her sleep. When my dad told us what had happened, I had kind of a mental breakdown because I realized I wasn't going to get the chance to try and salvage that relationship. I wasn't going to get the chance to try and, get her to understand why I did what I did because she was gone. So then I was angry for a while because I was mad I wasn't going to get that chance. I was mad that she didn't take care of herself enough to be there and be present in my life for all these important things that were happening, because this was my senior year of high school when she passed away. So, you've got graduation coming up. I had just been accepted to the University of Florida, which was a big deal, and nothing, she was gone. But anger just felt awful. It felt disgusting. It was kind of a weird, like, contradictory, like, I should totally be mad at her because of what she did to me, but also, like, she's my mom, and during that time I started to understand, like, she had a lot going on that she wasn't getting the support to actually take care of. The substance use was one thing, and then we found out that during the court proceedings for my dad to get custody, she had gotten the psychiatric evaluation. She had been diagnosed with something. We just didn't know what, because that was sealed in the court records. We just knew she had been diagnosed with something. So I started to get a picture, right, of my mom where she was struggling. She wasn't finding the support she needed to take care of herself. And her mom was very manipulative, very awful, basically reinforced all of her bad behaviors, like the substance use and stuff, excused them, tried to make my dad look out to be the villain. And so it took a few years and it was kind of stewing in the back of my head. But one day I finally went, I could have been my mom. I mean, if I hadn't gotten the support I needed, I could have ended up just like her, like suffering and struggling to take care of myself. I mean, that's the exact reason why I didn't want to have kids anytime soon at that point. I still don't. I'm like, I don't want to have a child until I know I am ready to have a child. And so it kind of made me go, she was suffering. And I mean, like, sure, that suffering and her ways to try and deal with that suffering ended up impacting us. And that's not to excuse any of the behavior, right? Like, it was still bad. It still impacted us negatively. But what's the old saying? Forgive, but don't forget, right? I started being like, you know what? Like, you basically, like, you were doing what you felt you had to like survive whatever was going on in your life and in your head. I can forgive you for that because I've done shit that's probably not good for me or for other people when I was struggling with my anxiety and depression. And so if I'm going to forgive myself for what I've done to people, right, I also need to be able to forgive her for going through what she did and, not being able to be there for us. Because if I can't do that, then am I really forgiving myself too? Right? Like, it's almost identical. And so it wasn't like a sudden switch of like, oh yeah, I'm good now. But I started being able to tell myself when I started feeling angry, I was like, she was suffering. It doesn't excuse what she did, but it gives us perspective and allows me to hold on to those pleasant memories I had with her and acknowledge that, like, there was good there. And there were moments where, for one reason or another, she had some clarity and she was able to get a hold of herself and we had some really good moments. But those other times she was struggling and she was suffering in her own way. And, how can I be mad about that anymore now that I understand that?
Yeah. Wow. Do you think like when you started going to counseling that kind of helped you kind of see that and like compare, like I can't blame myself or like I get mad or react that way too, like I need to do inner work too. Do you think that kind of came from counseling or that kind of led you to want to look more into counseling after that situation happened?
I think it led me to counseling. It happened a bit before. And so there was stuff like that. And then, well, the reality is I tried to do pre-med and pre-med was awful. And I realized that wasn't for me. And then I was like, oh yeah, everything I care about has to do with mental health and psychosocial issues and all that good stuff. Part of which was realizing that my mom was suffering, not getting the resources she needed, and also not being told that maybe she should go get help for her substance use probably didn't help any either. So what I think counseling school has done is it's given me even more perspective. Like I already had a pretty good perspective, but now I'm learning more of like the inner workings, right? And understanding like, especially the substance use portion, because all I knew was what my mom was doing, right? But going through my counseling program and going through like our substance use classes and stuff, I've been like, oh, this is so much harder than I could have ever possibly imagined it was to deal with. And it really made me realize, like, good God, her mom was basically reinforcing the behavior. Of course, she didn't go get help. Like, I wasn't old enough to be able to tell her that. She wasn't going to listen to my dad because she kind of hated him. And so no wonder, right? No wonder she didn't go get help because like the only people in your life that you're gonna be willing to listen to are basically telling you you're fine. And it really made me see now I'm just mad at her mom. The anger moved on. But not that bad. I recognize that there's probably some kind of like generational thing going on there from like the way her mom treated her, she treated us, right? And I think that's another thing that's really like clicked for me going to counseling school is realizing this has been a pattern probably that's been going on through generations at this point. And the important thing, right, is like I'm not able to fix what happened to her, and I'm not able to fix what happened to my grandma. I can work on what's going on with me so I don't pass it on. So that's kind of the perspective I've gotten since coming into counseling school.
Absolutely. It's beautiful the work that you did for forgiveness. It really does strengthen, I mean, that piece between self-compassion and compassion for others and forgiving ourselves and forgiving others. And I love that you talked about not forgetting because it is so true. That's such a barrier for forgiveness sometimes, that idea of like, I'm not going to say it's okay what happened. And nobody is ever asking anybody to say it was okay because it wasn't. And but forgiveness is something that we do for ourselves. And so your explanation of that of like I felt crappy, like I hated how it felt when I was angry, right? And I decided I don't need to do that. I don't want to do that. And the way through that is forgiveness, but not forgetting. And I think that's so beautiful. And so you do a lot of advocacy work as well, within your role as a student and then outside of your role as a student. Can you tell us about your advocacy work?
Yeah, so outside of my role as a student, really my big thing is like sharing my story, right? I've done a lot of like I've done other podcasts. I write pieces for different websites, and I've done a few speaking engagements in my area, like at University of Florida and for local nonprofits here in Tampa. Really, my goal here in sharing my story is A, the right person might hear it and feel seen, like I didn't feel when I left treatment or when I have a million things going on at this point with me, but treatment's the best like example of what I'm talking about. The other big thing that I think I'll start doing more of once I graduate and I've kind of gone through my training is the actual like advocating for more mental health resources part of it. I do a little bit of that now, but like that's coming from someone who has, experienced a need for this thing, right? Going to counseling school and like training is also giving me the resources to then be able to go, all right, I have, the experience to tell you this is probably necessary. I also have the training to tell you this is necessary. So it's kind of been a wonderful, like slow combining of the two pieces. In school, um, mostly just training, right? Trying to take whatever classes I see fit that will give me more expertise. So when I go out there, I am able to advocate for these things. So, like child and adolescent specific treatment classes. I'm also doing we have a grant program here called the HRSA. Yeah. It lets us work in integrated behavioral healthcare settings in the Tampa Bay area. So I love the integrated behavioral healthcare model. I love it very much, which I guess for anybody who doesn't know what that is, it's where they take mental health services and they incorporate them into your doctor's office. So counselors and doctors work hand in hand in the same office to provide you with not only your physical needs, but also mental health needs in the same space to make those services more accessible. I love this model very much. And I think it's a perfect example of what I've been saying for years, which is there should have been a counselor rounding with the oncologist. That should have been a thing to not only take care of, your physical needs, but also how are you doing emotionally today? I know you've had your chemo recently, and I know that doesn't make you feel good. What can we do to help you today? That kind of stuff. So this grant program is a great opportunity for me to be able to jump into this model in practice in my local area. With any luck, I'll be working in the USF clinic network, which will be great because USF partners with Tampa General Hospital here in the area, which is actually the hospital that I got treated at. So it's kind of a funny homecoming moment in a weird way. So my goal really is just to learn as much as I can in that integrated behavioral health grant placement, with the goal, hopefully, of them liking me enough that they just ask me to stay when I graduate. We'll see. But long term, finding a placement in one of the integrated behavioral health clinics in the area, and then eventually being able to go to Tampa General and go, hey, so have you thought about hiring counselors to go with your like pediatric specialty clinic? Have you thought about that? Here's all the reasons why you should do that. Coming from someone who was treated at your hospital many years ago. So the student part is really just learning all I can because it makes me excited. So that way I can then take that and my public speaking expertise that I do have from all my experiences and combine them and go out into the field and be like, here, now that they're together, believe them more, please. Really, like just having that little bit of extra like knowledge to be like, I promise I know what I'm talking about. Please listen to me.
Yeah, definitely. You'll have not only the experience, but also the education to back you up. Kind of with that, you are currently and have been like a counseling client and patient, and now you're going to transition to be a counselor. Are there experiences as a patient that you want to take into your role as now a counselor that you think will help shape how you do counseling yourself?
Definitely. I think so. I guess the first session with my therapist is actually a really great moment. That therapist I found in the community where I was like, that was a really good fit from day one. I knew what holding space was when I came into this program because he did it so well for me that it's impossible to forget what that felt like. Because when I came into counseling with him for the first time, I was so nervous about having to explain all my trauma. And like, I was like, is he going to look at me weird? Because I'm like sitting here just talking about all this stuff like it's no big deal. Like, because I'm an intellectualizer. My default is to not feel my feelings and to just say things out loud. And I just remember like I would start talking and then I'd stop and he would just sit there, which I was very confused by when he did it. But now looking back on it, I'm like, oh, he was giving me a moment, so I had no choice but to feel my feelings about that. And I remember I broke down crying and he like handed me tissues and he was like, it's okay. You need to feel those things. You can't just go through life talking about these traumatic things that happened to you as if nothing happened to you. And we're going to work on getting me through this. And it was just such a moment. I could feel it break down all the walls in me around those feelings. And I broke down crying, and it was like every single emotion related to the cancer and the abuse and the struggle was just coming out of me all at once. And it really just, it made it so I was like, oh, yeah, this is way worse than I thought it was. And so, like, coming into this program and even going out of this program, I know very well what it means to hold space for people. And it's something that I definitely want to carry with me as I go into my next field placement and I go into my practice, because I am evidence of just how much holding space for people gives them the opportunity to grow. Because in that moment, it was, and then through the course of all of our counseling, there were little moments like that where he held space and I realized things that I might not have realized otherwise. Like, oh crap, I probably need to go seek medication. And oh boy, I still struggle with being disabled. And I wouldn't have had those things happen if I hadn't been given the chance to have someone hold me like that and give me the emotional support to be able to look at those difficult things. So that's probably the most important thing for me from my counseling experience.
You're going to be a great counselor.
Thank you.
I'm so excited. You are like this like insightful ray of sunshine. I'm so excited.
Would you believe I said for years that I'd be a terrible counselor?
Oh,
I was like, no, there's no way. I'm never going to be a counselor. That would be such a bad. And then I started the program and I was like, oh, all my trauma makes me a better counselor. So I understand. That makes more sense.
Exactly. Oh my goodness, you're going to be a wonderful, wonderful counselor.
Thank you.
So excited. And I'm so excited for that possibility that you could be making rounds with an oncologist in a children's section. Oh my gosh. Yes, I am also.
I'll fight.
I'm going to be following up with
I'll
you.
be like, listen, I'll do all the work. I swear. I'll set it all up. You don't need to do anything.
Uh-huh. Oh, I'm gonna be following your page. I am so excited for that future. And it's so, so needed. And you're doing all the things to make sure that the experiences that you went through are going to help so many other children in that situation. I think it's just so, so beautiful. Thank you for all the work that you're doing out there, and that you're going to be doing with those children. It's incredibly meaningful and important work, and you've done all the internal work, and you're continuing to do the internal work to be able to radiate out that forgiveness and that healing. It's just beautiful. So if you could give one suggestion, you had talked about, when you're doing your advocacy, you're hoping that one right person hears it and hears that they're not alone. So if that person is listening, what suggestion might you give them if they're on the fence maybe about starting counseling?
I've been thinking about this whole time, and I've been going back and forth about what I want to say. I think what I want to say is whatever you've been through that's made you consider going to counseling, right? Going to counseling is not going to be in any way scarier than whatever it is that brought you to think about it in the first place. And I mean, like, that's kind of something I've had to do over the course of my life, is realize like what I've been through has probably been a lot worse than what I'm going to be through for the rest of my life. And I think counseling is a big example of that. No matter how scary it seems to go tell all your thoughts and feelings to a counselor, there's no way it's any scarier than whatever is bringing you there in the first place. And counselors know, not just because they've had training to understand, but a lot of them, and I mean a lot of them based on how my cohort is, have been through shit too. They know what it's like to be in the middle of all that and to have to work through it. And it might not be the exact same experience you've been through, but at the core of all of them is the understanding that we were suffering and we need help to get through that suffering. And so honestly, just like look back at what you went through, look at going to see a counselor, and just realize that no matter how scary it is, you've done harder things and you're going to get a lot of benefit from doing that next thing and going and seeing a counselor.
That was really good advice. Yeah, good job. Well, thank you so much for being a guest. We really enjoyed speaking with you. If you are interested in connecting with Cheyenne, she is on Instagram and Threads at resilient_AKA, or her website is CheyenneHeflin.com. And I'm sure we'll link those in our show notes too.
I'm Cheyenne Heflin and I need a counselor.
And I'm Chrissa Hunt.
And I'm Julie Johnson, and we need a counselor.
And so do you.
Thank you for listening to the You Need a Counselor podcast. We are so grateful that you're here. Now, we want to hear from you. Text us or give us a call at 515-650-3231. You can also find and connect with You Need a Counselor on Facebook and Instagram. If you've enjoyed today's show, please take a moment to like, review, or leave a comment, as all of these things help others to find and benefit from the podcast as well. If you're in the state of Iowa and interested in mental health counseling or behavioral health intervention services, give us a call at 800-531-4236.